Senator Sanders.
Thank you very much, Mr. Chairman. And let me thank all of the panelists for the hard work they're doing and for being with us today. It is sad to say that we have a president of the United States, the leader of our country, who from day one downplayed the dangers facing this country from the pandemic, who told us that the crisis would be over in a few months, that we did not have to worry, who fired those members of the government who wanted to act aggressively and, among other things, at a time when we need international cooperation, cut funding for the World Health Organization. But let me also say that I think we understand that facts are terribly important. Not everybody, that we don't fully understand all of the ramifications of the COVID-19 epidemic. But let me ask Dr. Fauci a few questions, if I might. For a start, the official statistic, Dr. Fauci, is that 80,000 Americans have died from the pandemic. There are some epidemiologists who suggest the number may be 50% higher than that. What do you think?
I'm not sure, Senator Sanders, if it's going to be 50% higher, but most of us feel that the number of deaths are likely higher than that number because given the situation, particularly in New York City, when they were really strapped with a very serious challenge to their healthcare system, that there may have been people who died at home who did have COVID, who were not counted as COVID because they never really got to the hospital. So in direct answer to your question, I think you are correct that the number is likely higher. I don't know exactly what percent higher, but almost certainly it's higher.
Dr. Fauci, let me ask you this. In the terrible pandemic of 1918, the virus exploded in the fall. It came back with a vengeance. Are we fearful that if we don't get our act together, as bad as the situation is now, it could become worse in the fall or winter?
Well, Senator, thank you for that question. It's a frequently asked question, and I think that possibility does exist. However, and the reason I say that is that when you talk about will this virus just disappear, and as I've said publicly many times, that is just not going to happen because it's such a highly transmissible virus. And even if we get better control over the months, it is likely that there will be virus somewhere on this planet that will eventually get back to us. So my approach towards the possibility of a rebound and a second wave in the fall is that A, it's entirely conceivable and possible that it would happen, but B, I would hope that between now and then, given the capability of doing the testing that you've heard from Admiral Giroir and the ability of us to stock up on personal protective equipment and the workforce that the CDC under Dr. Redfield will be putting forth to be able to identify, isolate, and contact trace, I hope that if we do have the threat of a second wave, we will be able to deal with it very effectively to prevent it from becoming an outbreak, not only worse than now, but much, much less.
Okay, let me ask, we've heard a lot of discussion about vaccines. Obviously, everybody in Congress and in this country wants a vaccine. We want it as quickly as possible, as effective as possible. Let me ask the Honorable FDA Commissioner, sir, if, God willing, a vaccine is developed, and if we're able to produce it as quickly as we all hope we can, I would imagine that that vaccine would be distributed to all people free of charge, or make sure at least that everybody in America who needs that vaccine will get it, regardless of their income. Is that a fair assumption?
Senator, I certainly hope so. FDA is very committed to making sure that all populations in the United States, including those most vulnerable, are included in the clinical trials. And
well, that's not what I'm asking. What I'm asking is, if and when the vaccine comes, it won't do somebody any good if they don't get it. And if they have to pay a sum of money for it in order to profit the drug companies, that will not be helpful. Are you guaranteeing the American people today that that vaccine will be available to all people regardless of their income?
Sir, the payment of vaccines is not a responsibility of FDA, but I'm glad to take this back to the task force. I share your concern that this needs to be made available to every American.
Does anybody else want to comment on that? Mr. Joral, do you think we should make that vaccine when hopefully it is created available to all regardless of income? Or do you think that poor people and working people should be last in line for the vaccine?
I'm sorry, Senator, were you asking me?
Yes, I was, sir. Yes, I was.
No, my office is one of the offices committed to serving the underserved, and we need to be absolutely certain that if a vaccine or an effective therapeutic or preventive is available, that it reaches all segments of society, regardless of their ability to pay or any other social determinants of health that there may be.
Good. So when you're telling the American people today that regardless of income, every American will be able to gain access to that vaccine when it comes.
They should gain access to it. I don't control, I
Well,
think
you represent an administration that makes that decision.
I will certainly advocate that everyone is able to receive the vaccine regardless of income or any other circumstance.
Let me just switch.
Senator Sanders.
All right, I'm sorry. All right. Thank you, Mr. Chairman.